I'm an unusual surgeon in that I'm also a patient. I've had spinal surgery. I've got 2 artificial discs and a fusion in my neck. I've had the concerns, the angst about whether or not I would be able to continue in my profession, continue as a spinal surgeon, continue to be an active part of my family. And going through that process has been so informative to me of what the patients encounter, overcoming the apprehensions, and how to recover and get back to a full life.
We got it, baby!
And it's made me a much more empathetic person and a surgeon. The Virginia Spine Institute was created by myself in 1992. And I always envisioned that I was going to work at an elite institute with great providers surrounding me so that the synergy would produce the best result for our patients. And today, we have over 100 employees, we have over 8 physicians, we have an army of physical therapists that are incredible, providing the best care available, physician assistants, an entire team of providers that are working in true harmony. If a patient has a particular problem, we can immediately get the opinion of a multitude of providers on the spot. So often when the discs get injured, they can rupture and a disc herniates out. The key to our success has been putting our patients first so that they can get back to their lives. Patients travel from all over the world to receive the best care at the Virginia Spine Institute. They have questions, they have fear, they have apprehension. And it is our job, and what we do best at the Virginia Spine Institute, is helping them answer those questions, alleviate that fear, and make sure they're aware of the complete array of options that are available for them. And then we can help them work through the process of finding what is the best treatment specifically for them and their condition.